Good morning, everyone. My name is Ruxana Begum, and I'm a student of in University of Suffolk. My student ID is S332938. Today, I'll be presenting an analysis of assertive communication in health and social care. The presentation will explain how assertive communication is, discuss its strength and limitation, examine how it can be applied in healthcare settings such as lower club and group practice, is a GP surgery where I'm currently working, and explore situation where it is particularly effective. I'll also discuss the challenges associated with assertive communication and suggest ways healthcare professionals can improve those skills. Assertive communication is an assertive component of effective healthcare because it supports patient safety, person-centered, and collaborative teamwork. Next slide is about what is assertive communication? Assertive communication is the ability to express thoughts, feelings, and concerns clearly, confidently, and respectfully. It allows healthcare professionals to communicate their views while also respecting the right and opinions of others. This communication style differs from passive communication, and individual may avoid expressing concerns, and aggressive communication where people may express themselves in a hostile, disrespectful manner. For example, if a nurse notices a potential medication error, assertive communication allows them to raise concerns professionally and confidently rather than remaining silent or becoming confrontational. In healthcare, assertive communication is clearly important because patient safety often depends on professionals being willing to speak up when necessary. Next slide is about comparison of communication styles. Understanding different communication style helps us appreciate the value of assertiveness. A passive communicator may express concern, but in a way that damages professional relationship can causes conflict. Assertive communication provides a balance between those two extremes. For example, if a healthcare assistant notices that a patient has missed a meal, a passive response might be saying nothing. An aggressive response might involve blaming colleagues. An assertive response would involve calmly informing the nurse in charge and requesting them the issue be addressed. Next slide. Next slide is about the strength of assertive communication. Those are several important strengths of assertive communications. Firstly, it improves patient safety because healthcare professionals feel confident reporting risk or concerns. Secondly, it reduces misunderstanding by ensuring information is communicated clearly. Thirdly, assertive communication helps build trust between healthcare professionals and patients because patients feel respected and listened to. Another advantage is accountability. Healthcare staff are more likely to challenge unsafe practice when they communicate assertively. Supporting person-centered care. Person-centered care focuses on treating patients as individual and involving them in a decision about their care. Assertive communication contributes significantly to this approach. Healthcare professionals must explain information clearly and check that patient understand what is being discussed. For example, a patient newly diagnosed with diabetes may feel anxious about insulin treatment. A nurse using assertive communication can explain treatment options clearly, encourage questions, and confirm understanding. This approach helps patients make informed decision and promotes autonomy. As a result, assertive communication supports the development of effective person-centered care plans. Collaborative teamwork. Healthcare relies heavily on teamwork. Assertive communication support collaboration by allowing healthcare professionals to share information accurately and confidently. During multidisciplinary team meetings, staff from different professions must communicate effectively to coordinate care. For example, a junior nurse may notice that patient condition is deteriorating. Using assertive communication, they can confidently raise concerns with their senior colleagues. This helps ensure them that important information is not overlooked and supports timely interventions. Consequently, assertive communication contribute to achieve shared patient care goals. Limitations and challenges. Although assertive communication has many benefits, it also has limitations. One challenge involves cultural difference. Communication styles vary between cultures, and direct communication may sometimes be interpreted differently. Another limitation is confidence. Some healthcare professionals may feel nervous about speaking up, particularly when they are inexperienced. For example, a newly qualified nurse may feel uncomfortable challenging a consultant decisions even when they have concern. Application in lower clapping group practice. Assertive communication can be applied in many situations within lower clapping group practice. This is a big surgery where we have more than 30,000 people, 30,000 patients, and 60 plus clinicians. During patients' consultation, healthcare professionals need to explain diagnosis and treatment plans clearly. In chronic disease management, patients require ongoing education and support. For example, a patient taking blood pressure medication may not fully understand how and when to take their medication. A healthcare profession can use assertive communication by explaining instructions clearly and asking the patient to repeat key information back. Assertive communication is also important when discussing safeguarding concerns or participating in multidisciplinary settings. Those situations require clear, confident, and respectful communication to protect patients' well-being. Improving assertive communications. Healthcare professionals can improve assertive communication through ongoing learning and reflections. Communication training helps staff develop confidence when interacting with patients and colleagues. Reflective patient is also valuable because it encourages professionals to learn from previous experience. For example, after a difficult patient interaction, a healthcare worker can reflect what went well and what could be improved. Developing cultural awareness can also improve communication and individual from diverse background. Also, using simple language for the people who has language barrier can help. Finally, seeking constructive feedback from colleagues can help identify areas for improvement and support professional development. Conclusion. In conclusion, assertive communication is a highly effective communication style within health and social care. It improves patient safety, supports person-centered care, and strength collaborative working between healthcare professionals. Although challenges such as cultural difference, workplace issues, and confidence issues can affect its effectiveness, those barriers can be addressed through training and reflective practice. Overall, assertive communication remains an essential professional skill that contributes to safer, more respectful, and more effective healthcare environments. Thank you for listening. And there are some references, the information I got from. Thank you.